Colleagues, this motion is before us today for really one simple fact. Martin Luther King Community Hospital estimates that unless it receives financial relief, it will run out of cash in December 2024. So, this motion will provide temporary financial relief to Martin Luther King Community Hospital so it can continue to be the vibrant provider of hospital services in the South Los Angeles and the greater community. This motion stays the course on a commitment this county made back in 2010. The county created and funded a nonprofit to provide hospital services to an underserved community of South LA that the county had failed to serve. The county created an unprecedented public-private partnership that ushered in a new hybrid model of care. MLK Community Hospital is unlike any other private hospital, not only in this region, but in the entire country. The county determined the size of the hospital and built the hospital and its emergency room. The county placed MLK Community Hospital on county land adjacent to county-run services, including the Behavioral Health Center and an outpatient center. The county funded the hospital through county-issued tax-exempt bonds. The county also created the nonprofit to run MLK Community Hospital and chose its first board members. At that point, the county and the nonprofit entered into a 40-year lease that included an unprecedented level of financial oversight from the county, which continues today. The county created MLK Community Hospital to provide hospital services for a population that the federal and state government told us we had failed to serve. And so this hospital is keeping its end of the bargain and more. It serves a patient population that is tragically, woefully underserved and has historic health disparities. And all the while, it meets nearly every marker of high unmet need and chronic illness. Supervisor Hahn, when we looked at the patient population, 42% of the patients are residents of your district. The South LA region is a medical provider shortage area. Per the county CEO analysis, the hospital's service area meets all health equity related indicators, including but not limited to concentrated disadvantage, the federal poverty level, the California Healthy Places Index, and the Centers for Disease Control and Prevention's Social Vulnerability Index. And in spite of all of those challenges, this hospital is getting rare top quality of care scores from our federal and state government patient oversight partners. I'm proud to say that the hospital was visited in the last year by Secretary of Health and Human Services, Xavier Becerra, and 2 days after Christmas, our junior senator in the U.S. Senate, Senator LaFonza Butler, came to tour because she'd never been there to see the hospital, so we were glad to host her. It is providing quality services despite the fact that the community's demand for emergency services continues to far outpace the capacity that the county built. Before it was built, the county had projected that the hospital emergency room would receive roughly 25 to 30,000 visits a year. Last year, the hospital handled 4 times that number, 100,000 visits. The CEO's report notes that MLK Community Hospital's emergency department burden is almost 3 times the statewide median. The hospital reports that its county-created financing model has not kept pace with inflation, including the rate of rising healthcare costs and the volume of patients seeking its care. The other troubling element is, most hospitals have to balance their books based on the types of patients they serve. Those with private insurance, private pay, and those who are subsidized. Martin Luther King Community Hospital, based on who it serves, frankly, in its geographic location, doesn't have that patient mix. And so it is only providing indigent care and those who receive Medi-Cal, and we know and have known for decades that the Medi-Cal reimbursement rate is not, doesn't come anywhere close to the Medicare reimbursement rate. And so a hospital with that patient mix, it suffers like Martin Luther King is experiencing now. By the county's design, this hospital is not eligible for disproportionate share funds that support other hospitals with high volumes of Medi-Cal and uninsured patients. I understand that was a strategic decision made when the board decided to reopen the hospital, and as a result, MLK is suffering today. So we, plus the hospital, are pursuing multiple options for long-term sustainability, including relief from the state, as well as managed care plans. They have a role to play in this too. So until we see whether our federal, state, and health plan partners will also step up, this motion proposes modest relief at no net county cost. I'll repeat, at no net county cost, to ensure that the LA community has uninterrupted access to top quality hospital care. For the big picture, our action today, the approval of this motion, will allow us to support a community asset that earned a rare 5-star rating from the Centers for Medicare and Medicaid Services for 2 years in a row. In the middle of the COVID pandemic, they still received a 5-star rating. Recently earned an A from Leapfrog, an independent national nonprofit that measures quality and patient safety among 2,300 hospitals, and a recent California Attorney General report ranked the hospital among the top scoring among public and private hospitals in the state for its compliance with the California Dignity in Pregnancy and Childbirth Act, which addresses implicit bias in the Black maternal morbidity and infant health care realm. For all those reasons, colleague, I ask that you help me, help us support a thriving community asset that is stepping up to the plate and is playing an integral role in the overall county's health care infrastructure, and support these allocations to support Martin Luther King Community Hospital's ongoing viability. Thank you, Madam Chair.